Hello and welcome to another episode of Health Matters. I am your health coach, Dr. Michael Chillemi. In this episode, we are going to embark on an ultimate deep dive into the world of headaches. If you've ever suffered from one, whether it's a mild or debilitating headache, you know how they can affect every aspect of your life. But have you ever wondered why we get headaches and how they affect us and what we can do about them? We'll uncover everything related to headaches, what headaches are, their anatomy, the different types of headaches, how common they are, what conditions they're associated with, and we're going to also take a deep dive into conservative and non-conservative treatments. Get ready to learning about the surprising complexity that affects millions of people worldwide, headaches. So let's talk about first, how common are headaches? Let's put headaches into perspective globally. According to the World Health Organization, 1 in 2 adults experience headaches every year. 30% of adults suffer from migraines at some point. For cluster headaches, they are rare, but incredibly debilitating, affecting only 0.1% of the population. Headaches are not just an occasional nuisance. They often are chronic, deeply destructive. Migraine headaches alone is the second leading cause of disability worldwide. Second leading cause of disability worldwide are migraines. That is a crazy statistic. Now that we know how prevalent headaches are, let's explore a little bit more. So what are headaches? Before diving into the types, causes, and treatments of headaches, first let's answer the fundamental question. What exactly is a headache? The term itself might seem straightforward, but understanding its physiological underpinning reveals a far more intricate process. The International Classification of Headaches, ICHD, defines a headache as a pain felt above the neck, often originating from a variety of structures in and around the skull. Let me explain. So a headache is technically a symptom, not a disease. It isn't just brain pain, as many might assume. In fact, the brain itself doesn't have pain receptors. Your brain has no pain receptors, meaning your headache is not originating from brain tissue itself. Instead, the sensation arises when pain-sensitive structures inside or associated with the skull are stimulated. These pain-sensitive structures include blood vessels, nerves surrounding the skull, muscles in your head and neck, sinuses in your face. Let's break down each part of it. So blood vessels, the role of the vascular structures in the headaches is arguably the most significant for certain types of headaches, like migraines and cluster headaches. The blood vessels in the meninges are protective layers surrounding the brain, are highly pain sensitive. When these vessels narrow, they constrict, or widen, they dilate. They can put pressure on the surrounding tissues, including sensitive nerves that detect pain. How vascular changes can trigger pain. So in migraine headaches, dilated blood vessels, they get bigger. Vessels stretch. When they stretch, the vessel walls activate the surrounding pain-sensitive nerves around the area. This process is further exacerbated by inflammation caused by neurochemical changes in the brain. In cluster headaches, brain vessels near the orbital region around the eyes swell, leading to intense localized pain. The pulsating or throbbing sensation commonly associated with vascular headaches is directly tied to blood vessel activity. Next, let's talk about the nerves surrounding the skull. The body's nervous system plays an integral part in all types of headaches, from migraines to tension headaches to cervicogenic headaches. While the brain itself does not experience the pain, the structures around the surrounding areas do, such as cranial nerves, which are densely packed with pain receptors. One of the main players here is the trigeminal nerve, one of the largest cranial nerve responsible for controlling sensation in the face, including the scalp and forehead. When this nerve is overloaded or irritated, it can trigger pain pathways that radiate across the head. There are other associated nerves within the headaches. The occipital nerve, which is located in the back of the head, often contributes to headaches that arise from neck strain or poor posture, commonly seen in cervicogenic headaches. Sensory nerves in the face and jaw may get triggered during certain secondary headaches, like headaches stemming from temporomandibular joint, TMJ headaches. How nerve activations contribute to pain. So pain signals from the irritated nerves are transmitted to the brain, which interpret them as headache pain. Nerve overaction and overstimulation is the hallmark feature of a primary headache like migraines and cluster headaches, as well as secondary headaches like post-traumatic headaches. Let's talk about next is muscles in the head and neck. So muscle tension in head, face, and neck plays a major role in triggering tension type headaches. Muscle-driven headaches. So think about how the muscles surrounding your forehead, temples, scalp, neck, and shoulders tighten during periods of stress and exhaustion or poor posture. This tension reduces blood flow to the area of the muscles, causing inflammation and irritation by nearby nerves, leading to pain sensations that typically feel like pressure or tightness around the head. When neck muscles tighten, they can irritate the occipital nerve traveling along the base of the skull, triggering headache pain that radiates upward. The cervical spine, where the neck meets the base of the skull, kind of right back here, is often implicated in headaches. For example, poor posture, looking at the screen can lead to chronic muscle strain, sparking cervicogenic headaches, especially when you're sitting there for a while, your head goes forward, head goes down, you strain all the muscles on the top of your neck. When you strain those muscles, that causes pain and irritation, and that can cause pain that radiates from the back of your skull all the way to the top part of your head. Next, let's talk about sinuses inside your face. So the sinuses are hollow cavities above and behind your cheeks, forehead, and nose. They are another major contributor to headaches, particularly seen in sinus headaches. How sinus pain can lead to headaches. When the sinuses are inflamed due to infections, allergies, or blockage, they create pressure within the skull. This pressure can affect adjacent tissues and nerves, causing headache pain in the forehead, bridge of the nose, and cheeks. Further sensations of heaviness or throbbing arise if the fluid buildup creates additional pressure during movement, such as bending forward or lying back. Brain chemistry, connecting it all together. Lastly, but certainly not least, the neurochemical changes in the brain heavily influence headaches, particularly those in migraines. The role of neurotransmitters. So neurotransmitters like serotonin and CGRP, which is calcitonin gene-related peptides, regulate inflammation and nerve activity within the brain. During a migraine attack, serotonin levels plummet, causing blood vessels to dilate, they open, and the nerves become hypersensitized. This explains the cascade of throbbing pain. You might have nauseousness, you might have visual disturbances, and sensitivity to light, often associated with migraines. Electrical activity in the brain. So auras, a hallmark symptom of certain migraine, is a direct result of abnormal electrical activities in the cortex, the outer layer of the brain. This leads to visual, sensory, or speech disturbances right before the headaches come on. Let's put it all together. A headache, then, isn't a simple pain in the head. It is caused by a complex interplay. Pain sensitivity nerves interpret irritations or stimulation as pain. Dysfunction of blood vessels contribute to the inflammatory process or pressure. Muscles tension puts strain on the surrounding structures and nerves. Sinus inflammations can cause localized discomfort. Brain chemistry amplifies or modulates these sensations, creating the throbbing, aching, or piercing pain that are characterized by headaches. By understanding the anatomy of headaches, we can better appreciate the diversity and complexity of how important they all must be addressed. So now we understand a little bit about the anatomy. I'm going to get you a little bit deeper. So we're going to get into a deeper dive into the anatomy. So because headaches are not just a complex phenomenon, they often feel like severe pain in the head. But in reality, they involve this intricate interplay of multiple systems in our body, include nerves, blood vessels, muscles, sinuses, brain chemistry. So let's get into it a little bit more. So the nervous system in the body, it's its communication hub, and it plays a crucial role in the occurrence of headaches. Pain in the head isn't felt by the brain, since the brain has no pain receptors. Instead, headaches arise from irritation to pain-sensitive areas of the head and neck. So let's talk about one of the bigger ones, the trigeminal nerve. I know we mentioned some of this before, but we're going to get a little bit deeper. So the trigeminal nerve is the largest of the 12 cranial nerves and has 3 branches that control sensation to the face, eyes, and scalp, as well as movement of the jaw. And headaches like migraines and cluster headaches, these nerves become activated, releasing neuropeptides that cause inflammation and pain in the meninges. The meninges are the protective layers surrounding the brain. This activation can explain characteristic sharp, one-sided pain experienced in migraines or clusters. Pain sensations from the forehead, eyes, temple are relayed by these types of nerves. The next nerve we're going to talk about is the occipital nerve. The occipital nerve, greater and lesser occipital nerves, actually 2, run from the upper part of the cervical spine to the back of the head. Irritation of these nerves is common culprit of cervicogenic headaches, originating from the neck issues and some tension type headaches. Poor posture, tight neck muscles, or repetitive neck strain can place stresses on these nerves, leading to pain radiating from the base of the skull to the scalp. How the nervous system dysfunctions leads to headache. So overstimulations of the pain pathways, the sensation of pain and the processing of the migraines occur when the pain sensing structures are overactivated or overstimulated. In chronic headaches, the nervous system becomes hypersensitive and amplifying pain sensation over time. Blood vessels in headaches. So blood vessels play a crucial role in headaches, especially migraines. Abnormal dilation or constriction of the blood vessels can trigger pain symptoms. Vasodilation, which is widening of the vessels. During migraines, the trigeminal nerve triggers a release of inflammatory chemicals that cause blood vessels in the meninges to dilate. Once they expand, they stretch the vessels. The stretched blood vessels put pressure on the surrounding nerves, leading to characteristic throbbing or pulsating of the migraines. So that makes sense, right? So when you're thinking about it, as your blood vessels get bigger, They increase the space that they take up, and they put pressure on the surrounding nerves around them. And that's why you have that throbbing type of pain. Vascular inflammation and cluster headaches. So cluster headaches are thought to involve abnormal activity of the hypothalamus, which can lead to dilation of the blood vessels near the eyes and consequently intense pain on one side of the head. So you might feel it on one side of your eye and around the top of your head. These headaches are also linked to vascular congestion, which causes swelling in the surrounding areas. The role in tension headaches. In tension headaches, blood vessels involve minimal compared to migraines or cluster. Instead, the musculos surrounding the skull play a bigger role, as we're going to discuss next. So let's talk about it. Muscles in the head. So tight or strained muscles in the scalp or neck are a key factor in tension type headaches. These headaches are most commonly experienced after prolonged muscle contraction or stress, which leads to aching pain that feels like a tight band around the forehead. Almost feels like you're wearing like a sweatband and it's constricting your head. So muscle tension can occur from poor posture, stress, anxiety, clenching the jaw, fatigue, or overuse. Muscle tension creates stress on sensitive nerves in the head and neck, leading to these dull, aching characteristics associated with tension headaches. Sinuses and headaches. So sinuses are air-filled cavities located in the forehead, cheekbones, behind the nose. How the inflammations can cause head pain. So if you get an infection such as sinusitis or an allergic reaction, it irritates the mucous membranes lining the sinuses, causing inflammation and excessive fluid buildup. The inflammation leads to pressure within the sinus, which affects the surrounding nerves, causing a deep throbbing pain. The pain is usually worse when bending forward or lying down due to changes in sinus pressure. Sinus headaches commonly occur with additional symptoms such as nasal congestion, facial tenderness, and fever. Finally, let's delve into the neurochemical changes, the role of neurotransmitters. So neurotransmitters send messages in the brain that regulate processes such as pain, mood, vascular responses. In headaches, serotonin and other neurotransmitters like dopamine and the CGRP play crucial roles. So serotonins in migraines, changes in serotonin levels affect blood vessel diameter. During an attack, serotonin levels may drop, causing the blood vessels to dilate, which then inflames the meninges and causes inflammation. In the CGRP, during migraines and clusters, the CGRP levels rise and causing the areas around to swell. And when they swell, they put pressure on the surrounding nerves and pain perceptors. The hypothalamus and pain. So the hypothalamus is a portion of the brain that regulates sleep cycles, plays a crucial role in cluster headaches. Dysfunction of the hypothalamus can lead to abnormal nerve activity during specific times of the day, which may explain seasonal or sleep type pattern of cluster headaches. Central sensation in chronic headaches. So in chronic headaches, the nervous system becomes oversensitive due to pain stimuli, a process known as central sensitization. This explains why chronic headache sufferers often feel pain seemingly from minor triggers like bright lights or mild neck tension. Let's bring it all together. Head pain involves an interplay between nerves, blood vessels, muscles, and neurotransmitters. Understanding their roles are crucial to understanding headaches. Now, next segment we're going to talk about is the types of headaches. There are technically over 150 recognized types of headaches. We will not be going over all of them today. It would be impossible. So there's 150 types, which broadly are categorized into two main groups. Primary headaches, basically meaning no underlying cause. These headaches occur independently. They're not linked to any other conditions. Typically, they include migraine headaches, tension headaches, cluster headaches, hypnic headaches. Next common group is secondary headaches caused by an underlying cause, meaning they are triggered by other conditions that affect pain-sensitive areas. Examples are sinus headaches, medication overdose, aka a rebound headache, cervicogenic headache, post-traumatic headache, headaches due to systemic conditions. So let's get into a breakdown of each of them in detail. So primary headaches are standalone conditions, meaning they are not caused by another medical issue. These headaches result from overactive or dysfunction in the pain sensitivity structures like nerves, muscles, and or blood vessels in the head. So let's get into it. Migraines. Migraines are a type of headache distinguished by their severe pain and other debilitating symptoms. They occur as reoccurring attacks, often starting on one side of the head and pulsating in nature. Some of the symptoms include moderate to severe throbbing or pulsating pain, usually on one side of the head. You might have nauseousness, you might have vomiting. You might have sensitivity to light and sound. In 25% of the cases, there is an aura, visual or sensory disturbances, maybe flashing lights or experiencing pins and needles or sensations. Migraine attacks can last from anywhere from 4 hours to 72 hours. What are some of the causes? So you could have causes such as hormonal changes, especially in women during menstruation or menopause. You could have a cause from stress, lack of sleep, dehydration, certain foods, chocolate, caffeine, or aged cheeses. Genetic predisposition. Migraines often run in families. What is the impact of life of migraines? Migraines are the second leading cause of disability worldwide. Again, I know I said it earlier, but this is a big, big deal. Migraines are the second leading cause of disability worldwide, affecting work, relationships, daily activities. Migraine sufferers often need a dark, quiet environment to recover during their attacks. Next, we're going to talk about tension headaches. Tension headaches are the most common headache worldwide, affecting up to 80% of adults at some point in their lives. They're often mild to moderate in intensity and less debilitating than migraines. So what are some of the symptoms? Dull aching pain that feels like a tightness or pressure around the forehead, temple, or back of the head, often described as a tight band. Kind of like if you, again, like if you're wearing a sweatband and you just made it too tight. They may involve neck or shoulder muscle soreness. You could have this on one side or both sides. Typically, you don't have nauseousness or vomiting associated with this, and typically they last between 30 minutes to several hours. Chronic tension headaches can occur more than 15 days per month. So some of the causes and triggers, stress and anxiety. Common triggers include work stress, emotional distress, or fatigue, poor posture, strain on the muscles of the scalp, face, and neck from desk work and screen use. Dehydration, skipping meals, or lack of sleep can also be a trigger. The impact on life. While less severe than migraines, tension headaches can disrupt productivity and overall well-being, especially if they're chronic. Next headache we're going to talk about is cluster headaches. Cluster headaches are extremely painful and a rare type of headaches, often described as one of the most intense pains a person can endure. They tend to occur in clusters, meaning short, frequent episodes that can last for weeks or months, followed by remissions. Some of the symptoms: intense burning or stabbing pain behind one eye, pain that often radiates to the temple or jaw or neck on the same side. You might have redness in one eye or drooping of the eyelid or pupil. You could even have a runny nose or nasal congestion on the same side. How long do they last? They typically last anywhere from 15 minutes to 3 hours and can occur 1 to 8 times per day. What are the causes? Exact causes are unknown, but believed to involve a dysfunction of the hypothalamus. So the hypothalamus typically regulates sleep and the circadian rhythm. They are typically triggered by alcohol, certain medications, or change in sleep patterns. How does it affect your life? The extreme nature of the pain can significantly affect daily life and mental health. Cluster headaches are often associated with suicide headaches due to the severe and distressing nature of them. Next, we're going to talk about hypnic headaches. Hypnic headaches are rare, most often occurring in adults over 50. They are sometimes called an alarm clock headache because they almost always wake you up from sleep. The symptoms include moderate to severe pain, usually felt on both sides of the head, often accompanied by nauseousness, sensitivity to light or sound. Usually lasts anywhere from 15 minutes to 60 minutes and may occur multiple times at night. The causes are unclear, but it is believed to involve abnormalities in sleep-related neurotransmitters like melatonin production. Alcohol and caffeine withdrawals may also be a trigger. The impact on life. Hypnic headaches disrupt sleep, leading to fatigue, irritability, and reduced quality of life. Next, we're going to talk about secondary headaches. Secondary headaches are caused by an underlying medical issue affecting pain sensitivity instructions, such as infection, injury, or system conditions. First, we're going to talk about is sinus headaches. Sinus headaches, the symptoms are dull throbbing pain localized to the forehead, cheeks, and the bridge of the nose. Pain worsens when bending over or lying down. Because when you bend over or lying down, you increase the pressure in your head, the fluid comes forward. That's why the pressure comes out. Often occurs with sinus pressure, nasal congestion, and post-nasal drip or fever. The causes: an infection, inflammation of the sinuses. Common triggers include both colds, allergies, and seasonal changes. Next, we're going to talk about medication overdose, aka the rebound headache. Symptoms: daily or near daily headaches, often worsen in the morning. Pain is similar to tension type headaches, but can mimic migraines. What are the causes? Overuse of painkillers, acetaminophen, ibuprofen, usually occurs when medications are used more than 10 to 15 days per month. Basically, if you're getting these type of headaches, you need to really back off your acetaminophen and ibuprofen, and those headaches should ease up. Next headache we're going to talk about is cervicogenic headache. So that's pain originating in the neck, radiating to the back of the head and face. Often confused with migraines due to overlapping symptoms. Causes: problems with cervical spine, neck pain, muscles, and nerves. It can occur with poor posture, whiplash, or arthritis. Next headache we're going to talk about is post-traumatic headaches. Often develop after a head injury or a concussion. While these symptoms are similar to tension headaches or migraines, they often involve neck stiffness, dizziness, memory issues, and irritability. The causes: the brain's inflammation response to trauma when the nerves and muscles involvement. Headaches due to systemic conditions. Examples. The first one we'll talk about is an infection. So meningitis or encephalitis can cause severe headaches alongside with fever, confusion, and neck stiffness. High blood pressure. Severe hypertensive headaches can trigger sudden, intense headaches. Hormonal changes. Estrogen changes during menstruation, pregnancy, or menopause can lead to severe headaches. So headaches are characterized by primary, which are independent conditions, or secondary, usually associated with something else. Identifying the types of headaches you have is vital for proper diagnosis and treatment, whether it's managing migraines with lifestyle changes or addressing secondary causes like sinus infection. Understanding the mechanism is crucial for understanding and getting relief. So let's get into it as far as how headaches affect your life. Chronic headaches, especially migraines, can disrupt nearly every aspect of your daily life. Physical impact, you get pain, you get fatigue, you have associated symptoms like nauseousness and visual changes. It might affect your work. So migraine patients can miss 4 to 6 days per year. Emotional changes, you can have depression or anxiety or frustration are common among chronic headaches. Social life, individuals with cluster headaches report avoiding social situations due to flare-ups. Real brief, I'm going to talk about the causes of headaches. We've done it already. Physical triggers, poor posture, neck strain, muscle tension. Lifestyle triggers, stress, alcohol, caffeine, and diet. Medical triggers, hormone imbalances, infection, and underlying hypertension. So as you can see, there's a lot of basic symptoms that can affect you. And really trying to understand them all is very, very important. Really brief, there are other conditions that are associated with headaches. So again, hypertension is one of the bigger ones. Severe headaches can be occurred by increasing in your blood pressure. TMJ, temporomandibular joint. So if your jaw is misaligned, you can get cervicogenic headaches. Autoimmune disease, lupus, and fibromyalgia patients frequently experience chronic headaches. And neurological conditions, tumors or infections like meningitis can cause secondary headaches. All right, let's get into it. Treatment options, conservative approaches to managing headaches. Headaches can drastically impact our quality of life. But good news is, many cases, especially chronic headaches, can be effectively managed with conservative treatments. These non-invasive approaches focus on addressing the root cause of headache pain without relying on long-term medications or surgery. Today, we're going to talk about 3 widely used, evidence-supported conservative treatments: physical therapy, chiropractic care, and emerging tools in regenerative medicine. So let's go over physical therapy. Physical therapy plays an important role in relieving headaches caused by tension, poor posture, and musculoskeletal dysfunction. It is particularly effective for cervicogenic headaches, which stem from issues in the cervical spine and neck muscles. These headaches often mimic migraines, but the root cause lies in the mechanical factors such as poor joint mobility, weak muscles, or postural imbalances. The goal of physical therapy is to reduce muscle strain in the neck, shoulders, and upper back, improve cervical spine mobility and alignment, correct postural imbalances, and help reduce those effects which contribute to chronic headaches. Addressing underlying biomechanical issues linked to migraine and tension type headaches are critical. Typically, some of the techniques they use: manual therapy, hands-on therapy for mobilization, for trigger points, stretching exercises, gentle stretches of different muscles, whether it's the upper trap, the levator, some occipital muscles, are helped to decrease pressure and nerve compression. Strengthening weak muscles of the upper back. So you want to strengthen your upper neck muscles, utilizing certain muscles to take pressure off your neck. Postural correction. So the physical therapist will help teach you how to sit at your desk properly, how to sleep properly. And these type of postural changes are important for your daily tasks. And that basically rolls into the ergonomic portion for your workstation and body biomechanics. Next, we're going to talk about chiropractic care. So chiropractic care uses spinal manipulations and alignment to alleviate headaches caused by mechanical dysfunction, especially those originating from the cervical spine. The goal is to restore proper movement, which relieve nerve pressure and reduce inflammation, which help manage both the primary and secondary headaches. Chiropractic care is particularly beneficial for tension headaches, cervical headaches, and even some key aspects of migraine headaches. So when we do our spinal adjustments, we use a controlled, precise pressure to realign the spine and get those spinal segments in normal, natural flow, which basically help realign and get the pressure and stresses off the surrounding areas, which typically trigger headaches. Adjustments are aimed to restore proper joint function and reduce irritation in pain-sensitive region. A lot of times we'll also use soft tissue techniques, whether it's massage or different trigger point assists to help break down the muscles around your neck. A lot of times we'll also have the top two bones of your neck. When those are misaligned, you might have headaches that go from the back of your head all the way into your eye, and it could actually make your eye flutter. So CO and C1 are crucial in getting some of your eye segments because they're directly related. And then when you go down into C2, C3, they can go to the back of your ear. So there's a lot of headaches that we do really, really well in treating those conditions. Other things that we might do is cervical traction. There's different traction devices to stretch your neck, take some of the pressure off your segments, and take the pressure off your nerves and muscles. By improving spinal alignments, chiropractic care can reduce inflammation of the nerves that can cause cervicogenic headaches, tension headaches, and migraine-like pain. Studies show significant reduction in the frequency and severity of tension headaches and migraines after regular chiropractic care. Regenerative medicine. So regenerative medicine is a cutting-edge field that aims to harness the body's healing potential to repair damaged tissue and reduce inflammation. For headaches connected to musculoskeletal conditions such as cervical spine dysfunction, arthritis, chronic muscle injuries, regenerative therapies like PRP treatments are shown great promise. What are regenerative treatments? These are therapies by promoting the repair and regeneration of tissue that may contribute to headache pain. Common applications: PRP, platelet-rich plasma. PRP involves taking a small sample of your blood, spinning it. When we spin it, it concentrates. Your red blood cells drop to the bottom. Your platelets are on top. Your platelets have your growth factors and healing agents. Typically, that top part, which we call liquid gold, are taken and injected into injured tissue areas. And for headaches, the PRP can be used to treat those strained muscles and inflamed ligaments, or even degeneration in the cervical spine. PRP reduces inflammation, decreases nerve irritation, and improves tissues healing over time. So typically the PRP, when you put it into the muscles, what it does is it heals the whole entire muscle, as opposed to doing some physical therapy and chiropractic where you utilize and break down the top layers of the muscle. Some of these muscles are really thick and it's hard to get to the bottom layers. But when you do PRP, it goes throughout the whole entire muscle, and therefore it heals the muscle. So PRP is meant to be a healing type therapy. The benefits of regeneration therapy for headaches. So it's non-invasive. You help avoid the need for surgery or long-term medical use. It's natural, enhancing the body's ability to heal itself. Long-lasting. By addressing the root cause of the musculoskeletal dysfunction, regeneration medicine offers sustained headache relief, especially for chronic sufferers. Meaning, this is not, when you do PRP, it's not meant to be a short term, it's meant to be more of a longer term treatment because you're healing the muscle. So with conservative options, They provide a natural way to manage headaches, addressing underlying cause and promote long-term wellness. Physical therapy focuses on relieving muscle tension and retraining the body for better posture and function. Chiropractic aims to realign the spine and reduce pressure on pain-sensitive nerves and muscles. Regeneration medicine repairs damaged tissues at a cellular level, offering innovative solution for chronic headaches linked to musculoskeletal. So imagine that if you went to a facility that did physical therapy, chiropractic, and regeneration for your headaches, how would that make you feel? Huh. I happen to know a place in Belleville, New Jersey that does that. That is exactly what my office does, is we do all of those typically to help with conservative treatment of headaches. Conservative treatment plays a vital role in headache management, especially for those seeking natural long-term solution. We focus on finding the root cause, whether it's muscle tension, poor posture, or inflammation. But there are some non-conservative treatments. So non-conservative treatments, we're going to get into right now. They involve medications and surgical options. So first, medications, painkillers, NSAIDs, opioids. You might have triptans or anti-nausea drugs for migraines. You might even have beta blockers or antidepressants. So very addictive type drugs. NSAIDs aren't as much, but opioids obviously are. Another medication that has come to the forefront lately is Botox injections, FDA approved for chronic migraines to reduce nerve signals. We're going to get into that in a minute. I'm going to get you into a little bit of a deep dive into that. Surgical interventions, rarely required, usually structural issues causing headaches like vascular abnormalities. The only time if you had a vascular problem, that's usually when you have a surgical intervention, but usually not. So let's get into a deep dive onto Botox for headache relief. So Botox, which is botulism toxin, is widely recognized for its cosmetic use, but it also has a highly effective medical treatments for certain types of headaches, particularly chronic migraines. In fact, the U.S. Food and Drug Administration, the FDA, officially approved Botox for treatment of chronic migraines in 2010 for patients whose conditions don't respond well to conservative medications. So what is Botox? Botox is derived from a purified form of the neurotoxin. I'm going to give this a shot here. Clostridium botulism. While the term toxin may sound concerning, in controlled medical doses, Botox is safe and effective. Its principal function is to block specific nerve signals, leading to muscle relaxation and a reduced pain signal. Chronic migraines are defined as headaches occurring 15 or more days in a month, with at least 8 of those involving migraine symptoms. Botox works by targeting one of the key mechanisms responsible for headache pain. It's going to block the nerve signal transmission. So the mechanism of the action, blocking the nerve signal. Botox is injected into specific muscles in the head and neck associated with the migraine. The treatment works by blocking pain signals in the nerve endings and the muscles where it is injected. It's technically preventing the release of the neurotransmitters like acetylcholine, which typically otherwise would cause and trigger pain and muscle contraction. So basically, it's relaxing or paralyzing the muscles involved in the headache related to that pain. So whether it's the forehead, the neck, or shoulders, basically Botox helps prevent the physical tightness that escalates pain during migraines and tension type headaches. Botox typically interrupts the pathway and the cycle of pain by affecting the process in the nerves around the brain, reducing sensitivity to the migraine triggers. The procedure typically takes anywhere from 15 to 20 minutes and is typically done in the doctor's offices and typically has no downtime. You can resume regular activities the same day. Botox is usually administered every 12 weeks for long-term improvement. And you usually need multiple sessions for this. Who is typically eligible for Botox treatments? Botox is especially designed for chronic migraine sufferers rather than individuals with occasional tension headaches or other headache disorders. So typically chronic migraines, 15 or more headaches for at least 3 months, migraines that last for 4 or more hours per day. Those are the typical cases, and or patients who have failed with other treatment options. So what's the effectiveness of Botox? Numerous clinical studies support Botox effectiveness in reducing frequency and severity of migraines. Botox can reduce the number of headaches by 50% or more after multiple treatments. Patients who experience migraines 15 plus days or more show the most effect. It's going to improve your quality of life because you're going to have less headaches. And unlike immediate pain relief, Botox acts as a preventative therapy, stopping migraines before they start. So basically, if you're going down the road, it's going to put you on a different road so you don't get into the accident. So your headaches don't come. The bottom line is Botox injections redefine chronic migraine treatments, offering a life-changing option for patients who struggle with frequent and debilitating headaches. Its ability to block pain signals and relax tense muscles make it a powerful preventative therapy, reducing migraine days by almost half in many patients. Botox is especially appealing because it doesn't rely on daily medication. And you can complement other treatments like physical therapy, chiropractic care, and regeneration medicine as well. So let's bring it all together. Headaches are far more complex than they seem. From the vast types of underlying causes and associated risks, they have a lot of treatment options. By understanding their anatomy, the triggers, patients can pursue targeted treatments to ultimately achieve better control of their symptoms. In today's episode, we really piece together the intrinsic puzzle behind headaches, a condition that affects millions yet remains misunderstood by many. Whether you're dealing with occasional headaches or chronic conditions, knowledge is the first most important step to healing. So as I always say, the information that I've given you today is my opinion alone. Please do not take my information as treatment advice, therapy. Please see your physician, your doctor for your specific type of care or treatment. Every case is different and every patient should be treated as such. This information is my opinion and my opinion alone. With that said, if you have any friends or family members that you like or you don't like, please pass this along to them. Maybe something I said here today can help them. The goal and what I do and why I do it is to help. If I can help one person, then it's always worth it, right? So it's what we put out there to try to help. Understanding what you have and don't just living with it, don't just accept it. Life is short. Do the best you can. And if you're having any type of headache type symptoms, take the first step, make a phone call, go see a professional and see if you can get it under control. Because at the end of the day, your health matters. Till next time, I'm Dr. Chillemi. Be well, be safe.